Okay.
Well, good morning. It's nice
Good
to
morning.
see you here today.
Good
And
morning.
another Monday, podcast Monday. I thought today we could start off by introducing ourselves and then kind of giving some idea to people that are interested in applying for positions at La Maestra. Like some, helpful hints and like how does the process go and what to do.
Perfect.
So I'm Zara Marselian. I'm the CEO and president of La Maestra Community Health Centers.
I'm Angelica. I am the recruitment director in the human resources department.
I'm Beatrice Fernandez and I'm the chief of HR.
Awesome. So let's say somebody is wanting to apply and they don't know if they should do this like through the website or do they call you or what's the best way to go?
So it just depends on the candidate. Some people are tech savvy and they can do it on their own. They'll go on our website, apply, submit what position they want to apply for, and we'll receive it on our end. They can send in their resume through the different recruitment agencies and websites that we work with. And sometimes we get people that call us and they'll ask, oh, well, how does this position work, or what positions do you have open, or what are the hours or the locations, and we'll guide them through it. So sometimes they'll email us directly, and we'll give them a little more help. So they're always able to call us at our HR department. And we do get faxes and people that walk in to our clinics and they'll do paper applications. Some people that don't prefer the internet, so we don't judge.
Right. I imagine some people feel like, maybe they might have a better chance if they speak to somebody directly or if they stop by the office, instead of kind of like submitting your application is kind of like into a black hole. You don't know if anybody's going to check the site. So I know you guys do, but what number should they call if they do want to go that route?
So our phone number for our HR department is 619-798-3977. And then they can ask to speak to one of our recruitment staff, and we will help them with whatever questions, or if they want to apply, we can help them with that.
We have quite a bit of walk-ins too, and sometimes they'll go to the front desk, they'll speak with Beatrice, and they'll sit there and fill out their application. We can even also help them on the computer with whatever they prefer. So we're pretty much have our open door policy, which is really nice, so they can stop in at any time.
That's really important. Then that way people feel like, that somebody's actually going to see their application. So what happens then? Let's say you gather the applications. What happens then?
So depending on the position they apply for, we screen them, we collect them all, and then we forward them to the hiring manager, which will then review them and pick their top candidates that they would like to interview. And once that happens, we reach out to them either by phone or email to schedule an interview if they're interested in coming in for an interview. Due to the pandemic, we did a lot of Zoom. So we do Zoom and in-person interviews.
Okay, so it's kind of like a hybrid.
Yeah.
That's great. So that by hiring manager, do you mean the director of that unit or department that was requesting that job to be filled?
Correct.
Okay.
So once we get depending on the department, they'll let us know their needs. We'll find those candidates and send it to them. We do have an idea of what managers are looking for, but we prefer to have the candidates speak to the manager. That way they can have that connection and see if they would work, if they would fit in within the department.
Sure. So I know we're always looking for that organizational fit for the benefit of the organization and also the employees, right? So it's great if the employees then understand something about the organization, about the position. They meet during the interview that supervisor or director that's going to be working with them and doing their evaluation and their training and all of that. So that they can get a good feel if that is a position that appeals to them, fits in with their ideals about their future and their career growth, right?
Correct.
And then on the other side, it gives the director the opportunity to meet the person, to see how they feel, about Do they have the skill set that is required by the job? Is this somebody that seems to be eager to work in this kind of field and obviously the healthcare industry? And in the areas of town that we have our clinic sites, right?
Correct.
A tip that I have for our candidates, which I did when I applied 10 years ago, go to the website, lamaestra.org, read through it, read the history. It's nonprofit. What do we do? The other services that we provide. I think that has a big insight is our website, just so that they know or if they feel that it's a right fit for them. Maybe it might not be. Maybe they just want to focus on just healthcare. But we do a lot of other. We provide a lot of other services. They might just not be interested in that or what our mission stands for. So a big tip is that they should really go to lamaestra.org, read about the history and see if they're interested and see if it's a right fit for them.
Right, and if they can see themselves being part of the team that is impactful in helping people's, lives to be, better with better health and better well-being, that's super important. When you were talking about doing the homework and looking at the website, I think that's super important. I know the vendors sure have done that. So like I'll get these emails that sounds like that somebody that knows me or has worked with the organization and it's just a vendor that wants to, have a conversation with one of our departments about IT or whatever. And they've done extensive research on our organization. It really surprises me somebody would take that time, but anyway, I know why. It's a good business tactic, but for the employees, definitely, number one, you should want to know where you're going to be working. You want to know the mission and you want to know like how long have we been here, 36 years, what all have we accomplished, how have we helped to redevelop the areas that we have our sites in. What have we done for people? And then do you see yourself being part of that passion, that commitment for the community? And you want to be part of that social impact. In a way, La Maestra has been, a social entrepreneur.
Right.
And just like really developing programs and services that meet the needs of the populations and the populations change, over time. And what's going on in the environment and how does that impact our communities and our populations and what do we as an organization, how do we respond to that? So I think that's really important for somebody to check out and see is that something that appeals to you, or do you really feel like you want to be seeing yourself in a private practice in a different part of town, and that's totally fine. That's great, but better to know that before you apply.
Right, and just know that we all wear different hats,
Right.
like, yeah, we do human resources, but sometimes I'm walking down the street and somebody needs help. I'll go in there and, interpret for them if they need it or guide them to the right floor. I mean, I like doing that. And I like walking down and people asking questions or, oh, is there a food pantry? Oh, yes, this and that, explain to them the generations program, just everything we offer. I just like to be able to walk down the street or people even walk in and they're like, oh, is this La Maestra? Where's their clinic? So then I'll walk them. I'll personally walk them. It's not going to hurt me.
Yeah.
So we just don't only wear the HR hat or just in general, all our employees just don't wear one hat. We wear many hats, and I think that's enjoyable at the end of the day, being able to help the community and our patients.
Yeah,
Sure.
in our interview questionnaire that we, when we meet with candidates, we do have a little snippet of La Maestra and its history, and we briefly explain a little bit about the circle of care and all the different, services we offer. And sometimes people are like, oh wow, we didn't know that you had all this. I'm like, yeah, we try to incorporate, a lot of information into the interview. That way they kind of get an idea and then they ask questions about, all the different services, because sometimes people just think it's like, oh, it's a medical clinic. Like, no, we're so much more than that. And we direct them to the circle of care and they're amazed with all the services that we have.
Yeah.
Sure. And I know it's hard for somebody to absorb all the information one time. I mean, me sometimes like I'm trying to really understand new material, new information. It takes like 3 times for me to hear it,
Yeah.
and then I feel like, okay, I'm pretty good with that information. Like I feel I know it enough to make my decision. But I think it's really important. The more times people can be exposed. So let's say if they can do their research before applying to La Maestra,
Mhm.
they know what all, our philosophy is, our
Mhm.
circle of care,
Mhm.
integrated care. It's the integrated holistic model, bringing social determinants into primary care and, the medical home for people. And I think that's an awesome combination, and it's definitely worked. The second time they could hear it is when they come in for maybe turn in their application, or they're asking for more information. And then obviously the interview, and then our orientation, which is the next thing I wanted to ask you about. So let's say that the interviews go forward. HR, you and the director, the manager is sitting in on the interview. They make their selection from there. And then what happens? Does the applicant get a call? How are they contacted?
So we do, once we selected a candidate that we want to move forward with, we do conduct reference checks on the people that, they submitted on their application, just to see, their past work history, and it could be personal or professional. We'll reach out to those people. Once we have that, we will make a formal job offer. If they accept the position, we'll move forward with doing the background check, the employee physical, and then they'll get all of the new hire paperwork. That does take about a week or two. The background check takes a couple of days, and the employee physical, whether they want to do it here with us at the clinic or with their primary care physician, it might, change the timeline, because nowadays it's a little difficult to get appointments. So that might be sometimes what takes a little longer. Once we have established, they completed their background check and their physical, we schedule them for a start date. And then that's when they come in, and we'll do the new hire training. It involves HIPAA, policies and procedures here at La Maestra, all of, information that protects the clinic and, employees, HIPAA, OSHA, all of those regulations, all of their paperwork. We will start implementing the circle of care orientation. So that is after they start. So they'll be invited for a second training, and that's when we'll have directors and different managers from departments and come and speak to the department, to the group, and let them know about all the services that we offer. And it's a little more a one-on-one, so they get to know who each person is, and they'll be like, oh, Cynthia, she works in this department, I can refer this person to her. And or dental, like we can talk to Rita, and if somebody needs a referral or whatnot, so we'll do that.
Sure, because we're constantly encouraging those internal referrals between the departments, and if there's a new employee, they might not know. They don't know how, and so I know the HR will give a good orientation and invite those directors like we used to do pre-COVID. That was really cool, because then you get a group of people that might be from many different positions that are sitting and listening about what this organization does. And they can see where they will fit in. And then they get to the idea of, okay, there's a lot of resources, a lot of tools that I can help my patients or my clients with, right? If I learn what those resources are and how to manage them.
And like you said earlier, when they're first starting, there's a lot of information to process. So we kind of want to just get them through the training, and then Angelica and her team provide the new hires with like a cool 1 or 2 week schedule of where they're going to be meeting their supervisor or their colleagues or whatnot, and then their lunch breaks and all that stuff for about a week or two to guide them for next gen training and stuff like that. And then probably within a month that they're here, then we'll want to do the circle of care orientation with them, just so that they're able to absorb and know what other programs that we offer.
I think that's great. And then obviously it depends on their position, but if they are going to be inputting information, let's say on next gen about the social determinants, then they'll learn, okay, where is the drop down button? How do what fields do we capture? All of that goes on the job training.
I think it's important for even providers to be part of that training, especially if they're new, just so that they know what the other services. I know, they know where they're applying at, but some providers don't know that we offer all of this in-house, different services. So it's nice.
Yeah, that's really very, very helpful. And it also makes, I think, the new employees feel like more welcome, like they have a support system, and they will. So like, let's say they're an MA or they're a referrals clerk or in whatever, they're from the clinical side, they're part of a care team, right? And so they right away know who they can ask more information. Maybe they're, trying to figure out a situation and they need that help and they need that assistance. So it's not like you're the new person on the block and you're totally hanging there by yourself.
Exactly. And all our new higher orientations are conducted on Mondays, just so that they start on a Monday fresh. And then after they're done, if we do have time, then we'll take the group and walk them up and down 4060 just to show them the different buildings, and then they're off on their way.
I think it's going to be really helpful, especially, you can start at the 4185. This is Chad. This is all of the, supportive services that people, social services that people receive through, our outreach. People, other organizations that partner with us refer to us. And then how does that differ from patients, helping patients that already are patients, right?
Correct.
And working, oh my gosh, with how many different partnerships we have. It's awesome.
So yeah, when we have new staff and they're seeing patients, if they come and ask for different things, like, oh, we're running low on food, oh, we have a food pantry here, and they can walk them down, or if they need legal services or whatnot, they can ask. And sometimes in conversation while they're waiting for the doctor, they're taking vitals, so like, oh, how's everything going? And those things do come up in conversation, so they can be more aware of different things that they can refer in-house. So it's really important.
Well, very good. So maybe next time we can spend more time about, orientation and what we really would like people to understand about our organization. And, to see if it's a good fit for them.
Yeah, definitely.
Okay.
Thank you guys.
Thank you. Have a great day.
Thank you.